My name is Yumi Wong, and I'm a physician assistant here at CVMG. I've been here for about 2.5 years, but I've been practicing in family medicine for about 13 years here in the Inland Empire.
Our extenders are people that buy into what our core culture is about, are well vetted, and provide excellent care, and are definitely able to continue to provide care when physicians aren't available. And in many instances provide care even when we are available because the need is there. And so we rely heavily upon our extenders to be able to continue to provide our customer service, our extensive primary care offerings, and to be able to extend our core culture in being able to provide great patient care.
It's always good to have another provider in the office because we're colleagues and we kind of bounce ideas and stuff off of each other. So for example, I have a little special niche in dermatology. So when Dr. Maljud runs across a rash or a skin lesion or something that he's not, comfortable with removing or familiar with, then he'll come and get me. I'll come in, see the patients, and give them what my opinion is, and if it's something that's in my scope of practice to take care of, we try to take care of stuff in-house.
And oftentimes we do consult with each other on patients, and I will talk to her about patients from perspectives where I know she is proficient, such as dermatological procedures.
I became a part of CVMG 13 years ago. I used to work in the urgent care with Dr. Smart and Dr. Majud, and they had a family practice, and they said, hey, we're looking to expand, we're getting busier, would you like to be one of our providers? And so I was one of the first PAs at CVMG, and since then we've grown, and our patients have become acclimated to all our providers. The PAs are very well trained, and we have our own set of patients that will just follow us, and of course every office has a physician, or they're available by phone, or any extension if we have anything where we run into where we need a consult. Yeah, the PAs work autonomously, and there's always a couple of different providers, and so a lot of us bounce ideas off of each other, consult, bring them into the room. Hey, this looks like this. What do you think of this is? A rash, or measles, chickenpox, and so we collaborate really well together.
With regards to interaction with the extenders, whether it be a nurse practitioner or a physician assistant, we're all very autonomous. We have a lot of our own patient load. We're seeing our own patients, and we have to stick to schedule for that. But periodically, there are questions that we will run through each other.
Hi, I'm Lauren Krostick. I'm a PA here at CVMG, and I have been with the company for about 2.5 years. I worked for a long time in the emergency room prior to going to PA school, and I really had never been exposed to PAs before. I always had worked with doctors, and I finally got the chance to work with them when they started hiring them in the ER, and I really just enjoyed the way that they interacted with the patients. I got to see them kind of work as an interdisciplinary team, like with the doctors and with everybody. They were part of a team, so it wasn't just solely them, but they did have the autonomy, and I really liked being able to have that interaction with the other people. So that kind of drove me to going down that route and being able to treat patients on my own, but also being able to interact as a team.
Along with just seeing the patients that we have here, and the patients that we need to get them back in soon. Sometimes it's hard to bring them back in soon, in 1 or 2 weeks. That's sometimes difficult. But the providers are willing and able to expand their schedule a little bit to accommodate, and that's one of the things that's been helpful.
My name's Michelle Oksana. I've been a PA here for almost 5 years. When I was going to school, I really enjoyed building relationships, or seeing the providers build relationships with their patients, and that's the most important thing with me. I want my patients to feel like they're comfortable with me telling me all kinds of things. That stuff doesn't leave the room, it doesn't leave the building, and if you're comfortable with telling me all your deepest, darkest concerns, great, then that means I can help you move forward and get past everything.
They're rarely calling us. Our extenders are very well trained, and they're really doing a good job, and I get a call every once in a while, a few times a week, when an extender calls actually asking for medical advice or an opinion on a patient's medical care.
It's always very interesting to take care of each and every patient. because everyone is different, and although we see trends, you have to take into account the personal aspect of it, and that's the challenge, right?
Patient education, that's one of the biggest things. Holding patients accountable, holding ourselves accountable. We see everybody from kids to middle-aged to older patients. So it's just kind of every room you go into, there's someone different in there. Somebody coming in just for cold, or someone coming in because they lost a loved one, or someone you're giving them, diagnosis of diabetes. So it's just it's really hard to just pinpoint one thing, but it's a eclectic amount of different things that we do throughout the day.
You get to see these patients over and over. You learn about them. You learn about their health issues. You really get to dive in with them and help them to the best of your ability so that they can live the best lives that they can. It's all about preventative measures and things like that, and I really like that.
Our physician extenders are just that, an extension of each of our physicians. We are fortunate to have talented, compassionate nurse practitioners and physician assistants we can count on, caring professionals who treat patients like family.